I decided to do my presentation on Peg Kehret's book, Small Steps, the Year I Got Polio. So I wanted to start off with what is polio in case somebody didn't know much about it. Polio is a highly contagious disease caused by the polio virus. It is spread through contaminated water, food, or contact with an infected person. Many people do become infected, but they don't show any symptoms and they don't get sick, but you can still spread it that way. Those who do become sick can become paralyzed, and it can be a fatal disease. In a very small percentage of patients, about 0.5, it can move from the gut to the central nervous system, which causes weak muscles and paralysis. This can also happen within a few hours to a few days. It just varies per patient. And polio can be preventable with the polio vaccine, but it is not curable. However, there are some treatments that can help, and you can recover from it with these treatments as well. So, in Peg's early life, she grew up in Austin, Minnesota. She did have a normal childhood. She had no problems with sicknesses or anything like that until one random day in seventh grade. At that time, she was really excited about homecoming. She was really looking forward to it with her friends, and because of that, she kind of ignored some of the symptoms that she had been having. A few days prior, she had a headache, and a slight fever and a sore throat. And then on this day, she had some muscle spasms in her leg that she kept noticing throughout the day, but she kind of wanted to blow it off because she was really focused on homecoming. But later that day, she ended up losing the use of her legs and she collapsed on the floor. She was able to get up and go home, but her mom wouldn't let her go to the homecoming parade because she ended up getting a 102 fever, and that lasted a couple days. Um, they did call a doctor who came to their house, and he wanted her to have a spinal tap. Um, and she just kept getting worse. She had the fever still. She started vomiting and she became weaker and weaker. And so she ended up going to the hospital, and it was concluded from the spinal tap that she did have polio. She was immediately put into isolation, and nobody was allowed to visit her, including her family. And she ended up waking up in the hospital one morning and she was completely paralyzed from the neck down. And this was just a really scary situation for her, especially because she was in seventh grade. She didn't know what was happening. She didn't really know what polio was. And it was all just happening so fast. And it was like one bad thing happening after the other. And her breathing also started to get worse. And she had to be transported to another hospital that had respirators, which is what this is on the right here. They call that the iron lung. And polio patients or somebody with some lung problems that couldn't breathe on their own had to be put in that and it would breathe for them. Um, some people never got off this machine. Some people it took a couple days, weeks, or even months. And she was actually put in a room with this boy who was in one of those machines, and he had been in that for about 7 months, and he wasn't showing any signs of getting better, which is really sad. But she was able to make friends with him and give him a radio, and they both kind of liked the same radio show, so that was kind of cool. And um, she did need an oxygen tent as well because of her breathing problems and her throat was starting to close. And this was like one step away from being put in the respirator. Um, and she says that a chocolate milkshake saved her life, and this is because she wasn't eating, she was super weak, and her throat was just almost closed, that it was kind of unbearable to um, eat anything or swallow any liquids even. And she really wanted a chocolate milkshake, but polio patients weren't supposed to have milk or dairy or anything like that because it can cause phlegm and they can choke on that, especially if their throat is closing like hers was. But that was the only thing that would go down. And immediately after that milkshake, she got a lot better, which was interesting. So Life with polio. Once her breathing got better, she was transferred back to another hospital and put in a room with four girls who she really became best friends with. She was paralyzed for 3 weeks, and after that, she slowly started to get better. She had to learn how to walk again, and she was in a wheelchair for a while. Um, and She started the sister kidney treatments, which is what they used. This was back in, I think it was 1948. She, the sister kidney treatments was two sets of treatments. One was stretching the muscles, which was really painful because the therapist would often go like as far until it hurt and then even further. And that would happen multiple times a day. And then the other one was hot packs, which was where the nurse would come into the room and put rags in really hot water and then take them out and put them on her muscles to kind of loosen them up. And that was also very painful for her. Um, like I said, she got to know the four girls that she was with, and her family really became their family as well. A lot of them, they didn't get visitors because their families lived so far and they couldn't afford it. And this is her right here in this picture. And this is her roommate Alice, who ended up living at the hospital because her family abandoned her when they found out that she had polio. That was really sad to read about, but it was nice that Peg's family was there for her, and they always brought them gifts and stuff to kind of cheer them up. Um, and she also mentions how simple things like she was really worried about the dress code in her seventh grade class, and she was kind of worried about how she could relate to her friends after this experience because it was just so life changing for her, and she kind of realized that that kind of stuff just wasn't really a big deal. Life after polio, she did learn how to walk again, and she pretty much fully recovered. She did go back to school and she graduated high school. She went to college and she also became an author. She traveled a lot with her husband, adopted two kids. She has won multiple awards for her writing, and she's an active animal welfare volunteer. She did say that she had some problems later on in life, like lower back pain and like some muscle pain, and that is because of polio, but she has lived a full life, and this book was really interesting to read. I really loved it. I actually read it in one day because it was so good. So I highly recommend it if you can read it. Um, and then these are just my resources. So